Good morning, everyone. So happy to see you this morning. It is, in fact, Friday. So that means that it's Coffee Klatsch with PAA.
Yay!
So we're glad that you're all here as we have some people still coming into the virtual room and finding their seat. Just welcome to the morning. It's as I stare out my kitchen window, it's a gorgeous day outside here in Licking County. I hope you're enjoying the weather as much as I am. So this morning I have the wonderful pleasure of being joined by Fran Gerbic. Those of you who know Fran know that she's the executive director of PAA, my boss. So I got to be on my best behavior today. And if you don't know her, then I would love to introduce you to her because she's a fabulous person to know. So.
Well, thanks, Bobby. I must say I've been enjoying watching everybody sign in and seeing names flash across my screen and seeing so many friends and colleagues that I've worked with in the past just makes me feel wonderful inside. And then even more so are the new names that I don't recognize. And I just think, oh my gosh, that's so exciting. So welcome everybody and thanks for joining us. And um, you know, in light of what's happened this year, this is probably the closest to a warm hug we're all going to get. So I really appreciate these times. I really look forward to them.
Absolutely. I think when we started this process, Fran, correct me if I'm wrong, when we started it, we thought, well, we'll just try it and see what happens. And it's been wonderful that we've been able to really have some regular conversations about some really important stuff going on in the world with some pretty amazing people out there across Ohio.
Well, I've said this before. I think when we live in a state as robust and prepared as Ohio is, we take for granted the resources that we have. Um, and then when you travel, and not that we're able to travel right now, but every time I come back to Ohio, I'm always amazed and reminded that we are blessed to be here. And the fact that we do have great people, great experts in our state who are willing to sit and chat with us and share their wisdom and provide us with, practical boots on the ground application, I think is just outstanding. And it's and truly, this Coffee Klatsch grew out of necessity because we were all struggling with the pandemic and what to do next, and we needed a casual way to share information and best practices, and it's evolved into something I think that has great value. So kudos to you for the idea, and kudos to everyone who's continued to Klatsch with us on a regular basis.
Yes, that's a perfect segue. So thanks for setting me up wonderfully.
Hey, we're a
So
team.
for for everybody who's joined us before, you know that over in your control panel on the right side of your screen, there is a materials section. For those of you who are joining us for the first time, over on the right side of your screen, there's a control panel, and in that control panel, there's a materials section. We have stacked that materials section full of supplemental information with today's conversation. Stuff that talks, there's some policies, there's some mock procedures that can help your communities, help the people that you work with, help you to develop appropriate content and impactful service provision. There's some data in there as well as some interesting facts that we felt you should know about today's topic. So at any time during the call, go ahead and click over to that material section in the control panel and you can access any and everything that's in there. I also want to let you know that our good friend James Syfax is in fact on the line with us as well. He is serving as our executive producer today of the Klatsch. So he will be monitoring the chat box. Mm-hmm. Everyone has been muted. So any type of comment or question that you may have, please put it in that chat box and we will make sure that we get to it. James, as I mentioned, is monitoring feverishly, so don't hesitate to send him all the questions that you have, and he'll chime in maybe every once in a while and remind me that we have some really great stuff going on in that chat box, so don't hesitate. Now, let's get to our special guest for today. Tony Coder is the executive director of the Ohio Suicide Prevention Foundation. He has been a longtime friend and participant in the prevention field, going all the way back to his days working in state government. I think Fran and I would be remiss if we didn't say that he is part of the PAA family as a former staff member here. And he's really doing some great work through the foundation and with the foundation's team to address mental health issues, to address the concerns related to how people are dealing with and coping with COVID, and really promoting across the state some really great work around suicide prevention. So we're really excited to have him here with us today. And as he's popping on to join us visually, I can't wait to have this discussion, and I think it's going to be robust and just as exciting as all the other clashes. So, ladies and gentlemen, please join me in welcoming back to PAA, Tony Coder.
Hey, Tony.
How are you doing? So great to be back with everybody. Fran, Bobby, the gang at PAA. How's Nathan and Brittany and the gang? Evie?
We're all doing well, surviving the pandemic, thriving in the pandemic. Yeah, it's great.
Excellent. Excellent.
Well, thank you, sir, for joining us this morning. As I mentioned, I think we have to have this conversation. It's important. We've got a lot going on. COVID, the ripple effect. I was having a conversation the other day with somebody, and I said the ripple effect of COVID is much broader and much deeper than I think any of us could have imagined. And one of the most prominent, obviously, comes in the form of individuals' mental wellness, their health, and their emotional coping skills, which unfortunately sometimes, when not dealt with appropriately, can lead to some pretty devastating actions and results. So let's just get into it, shall we?
Excellent.
What do you think, or what are your thoughts on how COVID specifically has impacted those who might have already been diagnosed with a mental health condition, or who might have been secretly dealing with it and didn't know about it?
Well, I think it's increased everyone's anxiety. Whether you have a mental health condition or not, our anxiety is, kind of through the roof right now. Not only, what's going on with the world, is there, when's the vaccine come, going back to school, we're seeing an awful lot of anxiety, parents and kids going back to school. Isolation is another big issue with this. And then we also, working with the Ohio Domestic Violence Network, how many folks are actually living with, abusers? Children, it might, school might be their only outlet to actually get away from, folks that are not being nice to them. And the same with, folks who are being abused at home. So, I mean, there's all kinds of things that we are really, really concerned about. And in our case, we really are nervous about how this could impact suicide numbers across the state.
Well, Tony, just this week at Ohio Law Stakeholder Call, they referenced the numbers of teachers who are dying by suicide. So if I was shocked by that, but at the same time, listening to you and hearing your descriptions, I guess we shouldn't be shocked.
Yeah.
I think we should, yeah. So thoughts on that?
Yeah, we've had 6 teacher, suicides in our state over the last month or so, which, and then somebody reached out, from another county that we hadn't heard from. So I haven't been able to talk with them, and they were asking for teacher resources. But again, they're feeling the same thing. They're feeling, do I go back? They have families at home. Am I going to go to school, teach, bring COVID back to my home, to my family? Am I going to get others sick or kids? I mean, there's just so many pieces that we're just unsure about. This is something we've never dealt with before, and I don't know if we've got a real. I think the policymakers are doing the very best they can, but we're in unprecedented times. So it's really, really difficult, and it seems like this, this virus seems to change as well. Once we think we've got a little bit of a identification about what it is, then, well, this is it. And I had COVID, frankly. So the interesting piece, and I didn't have bad symptoms, but the interesting piece for me was when I had it, I went through. It was worse for me because of all the stories. I was thinking to myself, is this it? Is this it for me? And then you hear these horror stories. Okay, now am I going to have some long-term health effects? This all plays with your mind. So it really is. There's so many things that we need to consider, and we're working with the Department of Education, and the department's put some pretty good resources for teacher secondary trauma on their webpage. ODE has, and so it really is shocking. But then again, truckers called me, the Truckers Association. They're struggling with it. Farmers have been for the last year and a half. They had a terrible year last year. There's a number of reasons why they, that they have some risk factors. So it's hitting an awful lot of folks.
I think it's
Well,
one
Tony,
of those things. I was
Go
going to say,
ahead.
I think it's one of those things, Tony, that obviously with when the pandemic kind of appeared and presented itself to the world, we instantly, and as we should have, went into, concerns about our physical well-being, like making sure that we were masking and distancing and all of that. And I hate to say this because it sounds like I'm downplaying the health precautions that we're supposed to take, which I'm not, but a mask isn't going to help somebody's mental well-being. To your point, those first responders who are out there every day, and some folks like the trucking industry, I never thought about truck drivers being, you would think, if talking about isolation, truck drivers are isolated. They're in their cabs by themselves most of their day. But if they're not being able to make runs, if they're not able to haul loads, that means they don't make money. I have family members who are truckers, and they get paid by the time they're driving. So if farmers or produce folks, or even, although if you ask me, me and my Amazon friends are keeping the economy alive and well, but we have to start thinking now, I think, and maybe we should have started a little bit earlier, but we have to start considering mental health equal to physical health, because we're going to start to experience some behavioral health concerns that are going to become prominent, right?
Right. Yeah, I mean, the AOD side has already seen, your increases in overdoses. And Fran, you serve on our little group. We're gonna have another meeting here in another month or so of opiates and suicide. How many of those are actually intentional overdoses as opposed to accidental? And we're trying to look at, okay, do we not only need to Narcan somebody or give them AOD treatment, but how many of those are we need to look into maybe some suicide treatment, mental health treatment as well. So it really is going to impact, I think, our entire field. And that's why I really absolutely love Marcy to death. And I'm so glad that Fran and you, Bobby, are the leaders of this organization, because I've loved and respected you all forever. I'm so glad that we are going to be able to work together, because I think more than ever, we're going to have to because of this epidemic. So I'm really grateful that we have this type of relationship.
Well, Tony, you and I've had parking lot conversations about shared protective and risk factors when it comes to AOD misuse and suicide prevention, and how together we're stronger because of the repeated messages and the repeated protective factors that can be put into place. What concrete and another thought, a lot of the stuff that you and I have been involved in over the course of the summer, because I do want people to know that, we are thinking about the surge post-pandemic, and there's a lot of conversation, and our state is being very proactive. I think we need to remind ourselves that our state is being very proactive and looking to what happens next to make sure that we have resources and that we're prepared. But that's very grass tops. And
Yeah.
sometimes it takes a while for that to get translated to the grassroots. And some of the people that I'm seeing here on that are chatting and signing in, these are people who are worker bees. They are people who are on the ground. What are some strategies that they can be employing now to help people elevate their protective factors? Enhance their protective factors. How can they help people navigate and be that warm handoff to the appropriate resources?
Well, I think honestly, knowing how to have a conversation, being able to have a conversation with somebody about, how are you feeling?
Hmm.
I talked to the farmers group the other day, and we're not going to talk about mental health. That's not what we do. And it's like, you know what? The mental health conversation doesn't have to take place while you're sitting across a desk. It can take place while you're working on a tractor, while you're
Hmm.
working on your, on your combine or whatever it is. The same with truckers. Do it over CB. Guys don't like to look each other in the eyes and talk, feelings, especially. So, having those, a lot of folks think that if you actually bring up the word suicide, that you're going to encourage somebody or put it in their mind. And really, all the research shows us that if, in a conversation, don't bring it up first thing, but in a conversation, if you say, are you thinking about killing yourself? Not hurting yourself, killing yourself. It actually can bring relief to a person to then be able to talk about it, as opposed to, putting any ideas in their head. And if they don't, then they say, no, my God, I wouldn't do that, whatever. But it is something that we know research shows it actually helps some folks. Making those phone calls, at the we had that Strive for Five. Call a couple people so often. I
Hmm.
just there was a suicide of a young man, 15 years old, back in June, and he got on his. He's from Independence. His mom told me he got on his Instagram and Snapchat or whatever those things are, and he said, "Look, if I have one person tell me they care about me, I won't kill myself. I'm giving you an hour."
Oh, oh
And
my goodness.
nobody reached out to the. And so the next morning, you know, the mom found this terrible scene. So, it's literally, we have a project with Ohio State called with Nationwide Children's Hospital called Caring Contacts, where literally they text a kid who comes into their ERs or the behavioral health clinic with, either a mental health issue or a suicide attempt, and literally follow-up texts have shown really, really great promise
Hmm.
of helping kids. And it's a text. It's so, there are so many things that we can do as individuals that are so easy, whether you're a clinician or whether you are someone who is, you know, slinging hash at the local diner, just being able to say, hey, how you doing? Reaching out to somebody. So it really is, we all play a part in helping.
It reminds me of back in my earlier life when I was a preschool teacher, and we talked about teachable moments. And then it also made me think about during my carpool time as a mom, where you took advantage of the time in the car going from practice to practice with your kids, checking in, talking about current events, but using that time for maybe not face-to-face conversation, but talking about some harder subjects where you could be honest and transparent and not necessarily have to make direct eye contact.
Yeah. I take my 11-year-old to golf every week. We are out, it isn't like I'm sitting there, and I'm not a good golfer. Good Lord. It is, if you've seen Happy Gilmore, that guy would put me to shame. So, but it's a time that we, it's not sitting across, how was your day, son? It is literally kind of chit-chatting over another activity. And so it really does, again, for guys, I don't know why we're wired this way, but it really is hard to look at someone. Bobby, you and I could get together at lunch and be like, how are you feeling, Bobby? And then it's like, oh, Lordy.
Well, it's funny that you say that, because your comments reminded me too of my beginning in prevention. Actually was with a violence prevention program in the early 90s. And we talked, I remember talking about, this whole idea, and trying to convince people that you have to speak honestly, not only as the person being asked the questions, but as the person asking them. And one of the things that I know we worked on with a lot of young people when I worked at the county level was we found a really great program from the Sandy Hook Promise organization called Start with Hello. And, I'm simplifying it for conversation's sake, but the basis of the entire program is literally you just walk up to somebody and say hello. And the impact that a simple engagement like that does for somebody who might be experiencing depression or anxiety or thinking about contemplating suicide is it takes them monumentally out of that headspace for that moment, which then offers the opportunity for larger engagement, including getting them to professionals if that's the case. So I think that's great, and it's something that people don't think about, that a simple, just small interaction can make a massive impact.
Yeah, absolutely. And I also don't mean to, I keep talking about men. I don't want to be so, gender, specific here, but women have higher suicide attempt rates in our state. Men, especially those over age 35, are 80% of our suicides. That's 8 out of 10 suicides are men over the age of 35. And it goes back to how are we making sure that we get having those conversations, treating folks, or getting them into treatment. So and it can be as simple as what Bobby just said, a hello.
Well, and I think that you bring up a good point, Tony, is that we have to customize. We have to know who we're impacting. We have to know how the message is best going to be delivered. And so yeah, I think this is an individual problem, so we need to have individual solutions. But obviously there are best practices that we all need to be paying attention to.
Right.
So I think that's important. Yeah.
Well, I think, Fran, you mentioned in the beginning of our conversation that these are unique times, and that not only are we dealing with a global pandemic, but we're also dealing with the impacts of social change. Our world is going through a much needed adjustment, and hopefully we're on the course to correct some things that maybe have historically been a part of our day in and day out. And when we talk about communities of color or minority groups, mental health and well-being is an issue that in some of those communities is higher. The concern is bigger because either culturally seeking support for mental health care is not a thing that happens, or because there is some injustices, or there are some barriers to equitable healthcare. How do we, as prevention folks and as friends of prevention, Tony, what would you think is the best way that we could reach out in those parts of our neighborhoods? Because they're in every community in every county.
I think we honestly need to build a workforce around, especially among the communities of color, African American community. We have an African American suicide prevention group at the Ohio Suicide Prevention Foundation, and it was literally it is, again, a lot of well-meaning white folk, and I have 3 black faces. And yesterday we talked about, look, I love you, Darletta and Reggie and Jordan, but I mean, if we're going to solve, we need to really fix the workforce problem. We need, it's hard, it's impossible for me as a 51-year-old white dude to go into, a community of color and be taken to where I understand their journey, or I understand. I've not had the uh, systemic racism piece played against me. I've walked in and I've seen a friend of mine who is African American. We hang out every once in a while. We'll walk in stores and I've seen the manager follow that person but not follow me. So I've seen some things, but when you get into, where are the providers in the African American community? We really need to nurture, I think, that as a subject, and it should be a priority for our organizations in the state. So that's something. Also, access to care. How do we make sure that people are able to get care? And I realize that telehealth has brought a whole new opportunity. But again, if folks don't have iPads or ability to reach those telehealth appointments, I know in Appalachia they have to. I've talked to some folks. They have to drive to the local McDonald's, or they don't have internet access. So access to care is another thing that really is we have to improve in communities of color. So it really is. It's a and it's not an easy fix that we could but we need to start doing it. To Bobby's point, we need to start doing it now.
Yes, yes, definitely.
Go ahead, Frank.
Okay. So, Bobby, you mentioned earlier at the beginning of this conversation some resources for families and communities, children and teachers about going back to school. I think it's okay not to be okay. Can you explain a little bit about what's involved in that toolkit, what's available, and hopefully the outcomes that you're expecting to see?
So what we want to do is it's an awareness campaign. We want to make it was basically created, and it was created in a short amount of time for young people around going back to school. It's okay to feel anxiety. It's okay to be be depressed, as long as you're talking to somebody, as long as you're reaching out. We don't want to, I think it's okay to not be okay is a kind of a popular saying in mental health right now, which is fine. But if we aren't also giving some solutions, look, talk to somebody, reach out, seek help, whatever it is, then I think we're really missing the boat. So we're continuing to develop that program to add those types of resources. You know, and we're going to instill in that something called one, and basically one phone call, 1 minute to someone else, 1 minute focusing on yourself. So it's really, we want it to be more of a solution oriented than just to say it's okay not to be okay. So that's kind of the impetus of it.
Good, because first blush, it feels a little and this is not a criticism, but I can see how people would interpret it as a band-aid, and
Yeah.
to your point, we want people to be empowered and we want them to be activated to take action. So that's good to hear, and I'm glad that's what the expectation is.
Yeah, I get tired of campaigns. I'll be frank. And yesterday I went on a profanity laden
What? I'm
diatribe
shocked. I would never expect that of you, Tony.
about we've got to do better than campaigns. We have to actually be seeking solutions. We have to be 50% of all suicide, 50% of all people who die by suicide, at 48, so almost 50, see their doctor within a month. of killing themselves. So we need to be reaching out to primary care physicians. We've had a large increase of the fastest growing or the largest increase over the past 10 years have been among African American young males in our state. We have to be doing better. We have to be able to provide services, to making sure that we are funding and prioritizing these communities. And it's all driven by data. So we've got to stop doing campaigns and cutesy slogans and instead build real solutions. So that's what I'm on.
Well, it's funny you say that because there must be timing must be right, because I had a very similar conversation with one of our state partners, and a friend of mine in Tuscarawas County actually posted a meme about suicide prevention and said, it's not just posting the suicide hotline or creating a campaign. Healthcare is suicide prevention, housing is suicide prevention, food security is suicide prevention, access to mental health care is suicide prevention. And it just, it was so strong and truthful in its simplicity, but it just gave me pause, because that's what we're apt to do these days. As we create a campaign, we create a toolkit, but it feels also very superficial. And so it just made me stop and think, yes, this is true, and this is what we need to be doing. We need to be doing concrete, solution-driven types of activities.
Look, I go to funerals. I mean, sadly, I attend funerals quite a bit from folks who let me know that someone's passed away of suicide. And the last thing I want to tell them, because I get the same question, or the same response every funeral I've been at, we've got to do something. And the last thing I want to tell them, wow, have you seen our great campaign? That is such an empty message. We really have to do much better. And I've got to be able to promise these families that, you know what, we are doing better, and not just creating campaigns. So I'm off my soapbox.
Well, I'm actually going to ask you to step back on, because my next question is very much to that point of how do we, we know this, that Prevention Action Alliance has action in its name for a reason. And so how can we tell our audience today, and what can we do as prevention professionals to really turn a campaign or a slogan into actionable results? What do we say to our physician, even if we're going in for our checkup? What should I ask?
Hey, I went in for a checkup and they gave me a mental health assessment. And here's how it went. It went like this. The lady sitting there. Have you ever taken drugs? No. Blah, blah, blah. Have you ever had are you feeling suicidal? No. Blah, blah, blah. Not, she made zero eye contact with me. She didn't I wonder, I so close, and I thought I'd get myself locked up, so I didn't. But I was so close to saying, yeah, I am feeling that. I wondered if she would have even turned around, or what her, and I don't know that person, but we have to, we have to be able to have the conversations, and for our providers, our physical health providers, to really care about what we're saying, and how can they be more in tune to the needs of the behavioral health field. So that if I was going to provide it, that is something. And does the person know our history, our family history of depression or of anxiety? I know that they use heart, our family history of heart attacks and blood pressure and all that. But do they really know our family history of all of these other pieces? And that can help, I think, really gauge their treatment of whatever it is that might be going through. I just talked to managed care this morning. I said, a managed care company, I really want predictive data. Out of everything else, they said, what do you want? I said, I want predictive data. More than I want money. I want predictive data that shows why are these 50% of people coming in and then a month later, they're dead. What are they going in for? What are they, are they going in for blood pressure? Are they going in for, so that we can have maybe a little bit of a model or some symptoms that we can really then say, these folks who are coming in for this, really might need a serious mental health assessment with some suicide questions involved with it. So that's what I would say is to look, working with providers.
Mm. It's interesting because I just, after a year of being in a new community, had an initial appointment with a physician so I can establish healthcare now that we've moved. And it was very similar to what you're describing, very superficial. They did take time to ask what I did for a living. And so that spawned a little bit more conversation about what's happening in the world. But I do think that our physical healthcare providers need some resources. They need some coaching. They need some training. And it makes me think about when we were providing strategies to address the opiate epidemic, how that recommendation for medical students to have specialized training and understanding how opiates impact the body and how to prescribe, I think we need to go back to the drawing board and provide that same kind of recommendation and see that implementation in our medical schools across the state, and actually have them participate in mental health first aid and have them participate in the QPR trainings that we're making available. It's a collective response that we all have to have. So I think those are very well, those are valuable recommendations. I appreciate that. And I think I was reading Bobby's comment in the chat. Yeah, that's a challenge for all of us. There's no reason why we can't start doing this grassroots campaign, this resistance against superficial mental health assessments. We can do that with our own providers. And again, it's that teachable moment.
Well, and we worked with some local bars around Columbus who reached out to us saying, they had a suicide of one of their patrons who had frequented. And, we just gave them a kind of a QPR. What are the warning signs that you need to be looking for?
Mm-hmm.
So it isn't just doctors, to Nanya's comment.
Yeah.
It's everybody. So, and she's right, medical staff, medical assistants, LPNs. So yeah, it isn't just but we reach out to bartenders and folks who, veterinarian, or I'm sorry, animal care clinics, not veterinarians, what are those? Humane societies. We really need to work with, because one of the things that people do that we have seen from other states is before they take their own lives, a lot of them will give their pets away.
Yeah, yeah.
So, how do we help those folks recognize that this person is, might be experiencing a mental health issue and are giving their pet away as almost a cry for help?
Yeah, I have read that as well.
Well, that brings us to the portion of our conversation. We have about 15 minutes left. So now is that time that we typically say, what's in your cup? So it's an opportunity, if you haven't asked questions in the chat box, to ask those questions. And while we're giving people a chance, Tony, to type, what are some programs at the foundation that people can access or they might not know about to help them propagate and perpetuate positive suicide prevention processes?
So we have, I would love for everyone in the state to get a QPR training. QPR is a simple 1-hour training. It's for the average, kind of the average, I call it, average Joe or average Jane, that is, signs of suicide, how to talk to somebody. It's an hour training. Mental health first aid is another that we have partnered with Prevention Action Alliance to provide to legislators, and we are also working closely with the veteran community on providing mental health first aid trainings for clinicians. The sad thing about clinicians is they don't get suicide prevention training in college, so we have to train them afterwards. So we have what's called AMSR and CAMS, which are 2 trainings that for clinicians that help when you're in treatment with someone. If you're a clinician, if you're a social worker, again, we have some other piece. We've got the Be Present campaign, which we're going to re-release. And we do an awful lot of advocacy around this issue, and that is something that Working Minds is another one. We just had a large, somewhere around 200 employers yesterday on a training around workplace suicide prevention, because we know that employers are starting to see employees experiencing some mental health, whether it comes out through anger or absenteeism, all of those types of things. So those are some things that we provide at the organization. And then we also have the state suicide prevention plan that we with about 30 other partners created and moved forward, and the governor introduced it earlier this year, which that's on our website. I encourage you to look at it, and there are probably 50 strategies on there that we need to address before December of 2022.
I was really impressed with the plan. I thought it was very comprehensive, very assertive, and so I have to compliment you and the work team that put it together, because I thought it was thoughtfully done and responsibly done.
Well, and we wanted it. I've seen some of these national plans, and there's two things that there are some beautiful suicide prevention plans in the country in other states, and so we took some of that. But it was also, I wanted to be more than creating healthy communities. That is not something that's measurable. We want something that is actually measurable, and that we can show that we're making progress in a couple of years. It's something that we can build on. The other piece that we really wanted to make sure that we did was, after we created it, we didn't want it to sit on somebody's desk. So we have an implementation team of again, about 30 or 35 groups around the state, organizations, both private and public, that actually we meet every month. How are we doing on this? Okay, aging, you need to step up. This school district over here, or you managed care company, you really need to start looking at this. So we're also implementing, as opposed to just letting it sit on my desk and collect iced tea stains from Starbucks.
Sure. No, I think that's amazing, because to your point, a lot of these plans are beautifully written. They are, action plans ready to be implemented, but then they don't get implemented. So the fact that you are staying on top of it and doing your due diligence, I think is outstanding. That's great. And keeping people accountable. We all need to be accountable.
We do have some questions popping into the box. One of the first that popped up on my screen was, any word on a QPR Train the Trainer coming up?
So we have been, we are going to have some coming up. We want to make sure that they're going to be in person. We have had reports from other states that the virtual QPR Train the Trainer it's disappointing, to say, because there's some practice pieces that are needed. So we have money to do it. We are chomping at the bit, and we're going to be doing those across the state as soon as we get some okay that we can do it. It's just, we don't want to do the training for training's sake. We want to make sure that people actually are able to understand it and utilize it to its effectiveness. And so that's why we've waited, just because we've heard so many, not glowing recommendations on the online piece.
Well, that's probably fair. We're all a little zoomed out, I would say.
Some questions also coming in about, is there anywhere that there is COVID specific data related to suicide or suicide prevention?
No, and that's what's bothersome, is we probably won't know for a year and a half from the Ohio Department of Health. So we've got anecdotal. I know that we're getting a number of more calls from people who have lost someone, but the Ohio Department of Health, they absolutely have to be sure of their data too. We don't want to mislabel or anything like that. So it'll probably be a year and a half. Now with that, hopefully next spring, I get the preliminary reports now, but there's something called a syndromic surveillance system, much like what they do with opiates, to almost tell real-time suicide attempt data in emergency rooms. They don't have it down to county level yet. It's more state level, and they're still working with the system. But we should be, I talked to ODH, and they said that probably next spring, that should be a public report where we can see, almost real-time data of suicide attempts coming into the ER, which will be a help. But most people die by suicide, at their home, so that it would not collect that type of data. But at least we can see maybe there's a contagion going on somewhere. But those are some systems. I know that the governor's office and his Innovate Ohio are trying to streamline all of those data systems so that we can have better and more streamlined data. So that's a tough one, and it's one of my biggest frustrations.
Thanks, Beth. Beth put in the chat box that there's some interesting information coming out of the ROX program, which is an evidence-based program that supports young women in their growth and development. And she did include the link in the chat box. So if people wanted to check that out, go ahead. One other question, or really it's really a request, Tony, of you. Sandra's asking, how can we become part of the campaign plans? How can we join the cause? And she says that she would love to be a part of the change and help suicide prevention.
Absolutely. We have coalitions that, Fran and I have chatted about. How can, the AOD coalition, suicide coalitions work more collaboratively with one another. So we hope that we'll be moving that forward. It's wonderful because Fran and I have talked a lot about how many things that we should be doing collaboratively, in parking lots and those types of things. Also,
we're nothing but flexible, Tony. Come on.
It's the only time we have anymore is parking lot. If you want to email me, put my email up there, tony.coder@ohiospf.org, and we can help get you involved. If you want to be any of our campaigns, whether it's back to school or African American suicide or older adult suicide, or whatever, we are more than happy to be able to accommodate, because we need all the voices in on this one.
A couple more questions. Are there specific resources for early childhood educators, those youngest amongst us, those people helping the youngest amongst us?
Actually, we really like the PACS program, and because that really, it builds those kind of protective factors that Fran talked about earlier. That with young people, we did have an 8-year-old about 2 years ago die by suicide, and a couple attempts of really little ones. But again, it goes back to the same protective factors and building that same resiliency in young people as the AOD. Identifying and playing on their strengths and being a strength-based model as opposed to anything else. So it really is that really basic or early elementary, I shouldn't say basic, that very early elementary. It serves both purposes, both mental health and AOD. So, we really try to push the PACS program and some of those other strategies that AOD has been so well in creating and championing for our cause as well.
But one nice thing about early childhood educators is they serve as liaison between parents and children, and So that, I mean, and I agree with you 100%. I love the PACS program. I think it does a great foundational start, and I'm a big believer that the more you hear repeated messages, the more it's going to start to resonate within an individual. But that goes for adults as well. And so I think if we could help our early childhood educators have messages to share with families and other caregivers, again, it's that layering of messaging so that it's consistent and it starts to resonate. So I thank Melissa for that comment. It's started some wheels to turn in my head. So more to come, perhaps.
We've got some information that I think is important just to share with the room if you didn't see it in the chat box. My good friend Annie Stevens from Sandy Hook Promise is with us today, and she posted that Sandy Hook has retooled the Start with Hello and the Say Something programs for all school attendance models at no cost to the community. So that's really great. I would encourage you all to check them out. They're also working diligently, and Tony, I'm sure you are as well, on House Bill 123, getting it passed, which is an effort at the legislative level to really talk about violence and suicide prevention programs in schools. And there's some really great work that they're also doing with Dr. Dewey Cornell and partnering with ODE. That's pretty cool. So check them out as well. Abby, thanks for your comments. Prevention First at their virtual coalition academy. We'll be having some conversations on suicide prevention and drug-free coalition collaborations across the tri-state. So check that out as well. We've got about 5 minutes left. Anything, Tony, that you want to share as a closing comment, or just something that the world needs to know?
Well, House Bill 123 did pass. So it has been passed, and I have checked whether it's signed by the governor yet, but it did pass out of the legislature, and it's either been signed or is in the process of getting signed by the governor. I guess the last thing I leave is, first off, thanks for all the work you all are doing. You're doing such great things, and I'm so excited that we're going to collaborate on so many things. The other is, reach out to somebody. There are some hurting people that you wouldn't expect. I got a note the other day from a mom of a 31-year-old man who, he killed himself, and he wrote his own obituary. And the very last 2 lines that I remember from that obituary is, COVID wrecked my life. I lost my job. I couldn't reach unemployment. I can't see my kids because of social distancing orders. So I'm just going to start watching from afar. I'm sorry. I'll miss you all. And it's like, how can we make sure that people who are really struggling, get that one phone call, one phone call that they can get, or that one text, or that one opportunity to be able to feel needed and wanted and loved. So, I don't care if you're worrying about them or not. Everybody likes to hear from somebody. So that's what I would encourage. We all have an opportunity to save lives, and I'm just grateful for your audience and for what all you do. So thank you.
Well, thank you for that. And I've said my whole prevention career that prevention is both a profession and it's a character. We do it because we care, and we do it well because we know what the science and the research tells us. And I think that's kind of a great summary, what you just said. And I, my challenge to everybody as well is to go out there and just be that light. We have a lot of cloudy days that have been surrounding us, and it's an opportunity for us to just understand each other on a different level. So thank you again, Tony, for taking the hour out of your Friday and spending it with us and helping the people that we know and love and work with do their jobs a little bit better.
Excellent. So, thank you.
If you have any questions for Tony, his email is in the chat box, thanks to James. And you can definitely reach out to him and the team at the Suicide Prevention Foundation. Don't hesitate to email Fran and me or anybody at PAA. We're more than willing to support your efforts and what you're doing and how you're helping to make the world a little bit happier, a little bit healthier, and a lot more safer.
Yeah,
So,
let me just echo what Bobby just said. These are, as Tony has said, unprecedented times. And if you have an idea that you want to see come to fruition, if there's something we can do to assist with that, we're stronger together. And so let us know, because we like to be challenged, we like to be creative, and we love to collaborate. So please don't hesitate.
absolutely. Thanks everybody for joining us today. Enjoy your weekend. Have a happy Friday, and we'll see you back here next Friday with our next coffee Klatsch. And just as a little teaser, Jill Smock from the Ohio Chemical Dependency Professionals Board will be joining us. Talking about professional development, some growth, and all that OCPS, OCPC stuff. Thanks, guys, and have a great weekend.
Thank you.
Bye-bye.
Bye.